speaker. Jane? We'll let them pass, get all that passed. Okay. Kind of cool in here.
Yeah.
We're on the corner where the wind is blowing. Oh. Fortunately, this is supposed to last about 2,400.
It's 53 yesterday.
It was 57.
The troopers warmed your car up nice this morning.
It would work overtime. Man, you walked up this house. Well, man, 2 hours later, I walked out the back over there. That wind was blowing, and it was 8th Street. Is the house okay, as far as we know? We're gonna have to check on it tomorrow morning. See if our pipes freeze or anything like that. Has everybody got? Everybody ready? There was a time that lock 'em up and throw away the key was the stock answer to any question about addressing substance abuse. But as anybody who works with addiction knows, tougher enforcement alone is only part of the strategy for a long-lasting, successful approach to Kentucky's drug habit. Attacking drug abuse demands a holistic strategy that includes not only an aggressive police and justice system, but also education, expanded economic opportunity, and robust treatment efforts. But those take funding, which, as we all know, has been in short supply in the Commonwealth. Today we are here, thanks to Attorney General Jack Conway, to make an important announcement that will make a significant impact on the future of drug treatment in the Commonwealth. Along with General Conway, we're joined by House Speaker Greg Stumbo, First Lady Jane Beshear, to make an exciting announcement that will expand treatment for substance abuse, including opiate addictions, for both adults and teens in the Commonwealth. Funding for this expansion comes from monies recovered by the Attorney General's office in settlements with 2 pharmaceutical companies. As the Attorney General will explain in more detail, the money will be used for a variety of programs, including the completion of construction of a Recovery Kentucky Center in Ashland, scholarships that help addicts participate in the Recovery Kentucky programs, drug-free homes for people completing and transitioning out of residential substance abuse treatment programs, strengthening CASPR, Kentucky's electronic prescription drug monitoring program, and school-based substance abuse screening. However, the bulk of the money will be used to expand sorely needed treatment programs geared toward juveniles. Adolescent and young adult substance use is a major public health problem in Kentucky. Based on national estimates, as many as 1 in 8 high school students in Kentucky meet criteria for a substance use disorder. The existing system of care is wholly inadequate to meet the current demand, fragmented, hard to access, and inconsistent. As a result, limited treatment options has led to many of Kentucky's youths with substance use disorders ending up in juvenile justice detention facilities or committed to the state child welfare system. Neither place is a long-term solution to this problem. We can and we need to do better. Today's announcement is a significant start in that direction. Fortunately, it comes at a time when broader changes in health care delivery are significantly increasing access to adolescent and young adult substance abuse treatment. These include expansion of Medicaid to cover more families, the addition of a specific primary substance abuse treatment benefit within the Medicaid system. Federal health care reform, which focuses on finding insurance coverage for all Kentuckians, and requirements that all private insurance plans cover substance abuse and mental health benefits. To realize the full potential of these changes and to truly impact outcomes for youth with substance use disorders, we must be willing to invest the necessary resources. And today certainly is a helpful step. Now, to make sure these funds are spent efficiently and put to best use, I am creating by executive order an advisory committee. The committee will be chaired by the Attorney General and also include the First Lady, who is co-chair of Recovery Kentucky, Secretary Audrey Haynes of the Cabinet for Health and Family Services, Secretary J. Michael Brown of the Justice and Public Safety Cabinet, Van Ingram, Director of the Kentucky Office of Drug Control Policy, J. Catherine Peters, CEO of the Kentucky Housing Corporation, and Dr. Alan Brenzel from the Department for Behavioral Health, Developmental and Intellectual Disabilities. Appointments made by Senate President Robert Stivers and House Speaker Greg Stumbo will serve as ex officio members of this committee. In tough economic times like these, we need to continue finding innovative ways to fund critical services. This is an example of that. And I want to thank everybody who has worked so hard to set out this strategy. But our particular thanks go out to Attorney General Jack Conway. Jack, we want to thank you and congratulate you not only on winning these settlements and winning this money for the people of this Commonwealth, but also wanting to use this money in a way that will do the most good, and that is to improve substance abuse treatment in the Commonwealth of Kentucky. Ladies and gentlemen, let me ask you to give a big round of applause to Attorney General Jack Conway.
Thank you, Governor Beshear, for that kind introduction. I also appreciate what you and your staff have done to make this announcement a reality. I also have to thank people like Karen Shea and Lynn Kissick and Mike Donta, who's here with us today, who have gone with us because they have lost children to addiction, and they've gone with us to talk to kids all around the Commonwealth of Kentucky to make certain that they are not part of the next generation to lose that fight. I also want to thank the kids I've talked to along the way. Several of the 40,000 or so, Mike, that we've talked to in the last few years have come up and told me the harrowing stories about what's happened in their family or what it was like to be dropped off by a school bus and have an ambulance outside of your home in Pike County when your dad just passed away from an overdose. And for those of you who've traveled with me or heard one of my conversations about the prescription drug topic, you know that I've always said that I'd like to see money from some of these pharmaceutical settlements that we had hoped to secure to be used for the purpose of creating more treatment beds in this state. According to a recent study by the University of Kentucky, this state has only about a tenth, 10% of the treatment beds that we need. And I felt very strongly that some of these companies, and this industry in particular, that has helped create this addiction problem in our beloved Commonwealth, should also help pay for the treatment that our people need. Last fall, it became apparent that we were going to settle two major cases that we had pending against Merck and GlaxoSmithKline. Today, I'm announcing that we've settled those cases, and over $32 million will be allocated to help create a new treatment center for adults, for treatment scholarships, and for a grant program to create more treatment beds for our juveniles and adolescents throughout the Commonwealth of Kentucky. This investment in treatment is indeed historic. It will save lives, it will save families, and it can help save parts of our Commonwealth that have been riddled by addiction. I think we in law enforcement have endeavored to do our job. Working with Governor Beshear and Speaker Stumbo, we've done a tremendous job in tackling the problem of prescription painkiller abuse from the law enforcement perspective. We've worked together on the passage of House Bill 1, which is now a national model. Kentucky is one of 2 states, along with New York, that require our doctors, for the most part, to check with the prescription drug monitoring program before they prescribe an opiate painkiller. We've closed half the pain clinics in this state. But I've always said it's not just enough to be tough on drugs, you have to be smart. And in dealing with the prescription painkiller epidemic as well as heroin, I've come to realize that being smart includes increased education and also increased treatment. And at the end of the day, we have to increase treatment if we're going to stop this cycle of addiction. These funds are going to expand treatment for youth and adults throughout the Commonwealth of Kentucky. As I've traveled the state, I've recognized that one of the most underserved areas for treatment in our entire Commonwealth is the northeastern quarter of this state, in the Boyd County area. As we tried to decide how to allocate this money, we asked Recovery Kentucky, what will it cost to complete that treatment center you want to build in the Boyd County area? We were told $500,000. Well, I'm here to tell you today that $500,000 is going from this settlement to complete the construction of that facility in the Boyd County area. As I mentioned, Mike Donta is here with me today. Mike is one of the parents who travels across the Commonwealth with me in our prescription drug abuse awareness program. Mike lost his son to prescription painkiller abuse. And when his son asked for help, and Mike tried to provide help by getting his son into treatment, he was desperate to find a treatment bed. Mike lived in Ashland. The nearest bed was E-Town, many hours away. But that's where he had to go to find treatment for his son. Mike, that won't have to happen anymore. That won't have to happen anymore. This plan we're announcing today also provides over $2.5 million for scholarships for non-correctional referrals for people who seek treatment at Recovery Kentucky centers. These will be 30 scholarships per year, awarded for each year of 2 years for each Recovery Kentucky center. We're now going to have 14 Recovery Kentucky centers. We think this will be about 850 scholarships available over the next 2-year period for people who right now cannot afford treatment. Nearly $600,000 will be used over 2 years to create 14 recovery homes for people who are completing and transitioning out of residential substance abuse treatment programs, an important halfway house step for those who are on the way to improving their lives. That money will provide for startup costs and rent assistance. As the governor mentioned, the largest allocation will be about $19 million to start a grant program that will fund additional juvenile and adolescent treatment beds at existing facilities and create new juvenile treatment centers. Far too many parents in this state have been forced to wait 90 days or longer to get their children the help that they so desperately need, or they've had to drive 4 or 5 hours away to find a treatment bed. When we started talking about this process and what we wanted to do with the money, the easier the political thing to do would have been to say, okay, this community gets one, or that community gets one. But what we quickly realized was that we had an issue of sustainability. We have Medicaid coming online, agreeing to pay for treatment. We want proposals from around the state, from the nonprofits, from public-private partnerships, from the providers who now have a funding stream. Bring us your best proposals. Show us the demonstrated need. Show us the sustainability of the program and the effectiveness of the program. And we now have a grant fund that we can help construct treatment facilities all over the state. And to those in northern Kentucky who I heard so loudly about a month ago when I joined with Senator Stein in support of the heroin bill, I want to say I've heard you loud and clear. Steve Stevens from the Northern Kentucky Chamber is here today. That particular area development district in northern Kentucky is underserved when it comes to treatment beds, and I'm pledging you today that we'll make certain some of this money gets up there to build additional treatment in northern Kentucky, Steve. I want you to know that. This grant program is going to be administered by an oversight committee that I will chair, in which Governor Beshear has today created by executive order. In addition to the grant program, the following entities will also receive money over the next couple of years under this settlement. Just under $6 million to upgrade and improve Casper, which Governor Beshear mentioned, in which he has been a leader in making certain that this system is interconnected with our surrounding states. We're going to upgrade it and make certain it's functioning properly over the next couple of years. We're going to allocate $1 million to the Chrysalis House in Lexington and to the Independence House in Corbin. These are two centers that provide substance abuse treatment for pregnant women. They've had trouble with funding recently, and this should take care of them for the next couple of years. We're going to provide $1.5 million to the University of Kentucky to train providers in the area of juvenile and adolescent treatment. We're going to give $1 million to the Kentucky Department of Education to develop a school-based substance abuse screening and assessment tool so that we can get to at-risk children before they enter the judicial system. And we're going to use $250,000 to create a database to evaluate the outcomes of this juvenile treatment. You know, it's not often that we get to say this in Frankfort, but this is an historic day. It's a day I've been working toward for about 6 years. First Lady Jane Beshear and I share a passion for this issue. I'll never forget Jane riding on that bus all over the Commonwealth of Kentucky when we were all seeking re-election as a ticket in 2011. And I think I was talking maybe with Wendell Ford and Steve Beshear about some of the litigation we had going on in the Office of the Attorney General. And Jane, as the co-chair of Recovery Kentucky, overheard me talking about pharmaceutical settlements and some money that might be coming in. And she quickly interjected and said she had some ideas if we ever got our hands on some settlement money. And she never let me forget it. And I can tell you anyone in the Beshear family knows that when she sets her mind to something, she usually gets it done. I want to thank you, Jane, for your commitment to Kentuckians who are working hard for a second chance. To try to help people who are suffering, I think, is one of the most noble things that anyone can do in public service. So thank you for co-chairing Recovery Kentucky, and I'd like to invite the First Lady up here to talk about what this plan can mean for Recovery Kentucky and the families it serves. Thank you.
First, let me just say to Jack and his entire Attorney General office, thank you. This is something that we've talked about ever since I became involved with Recovery Kentucky. And I have to tell you that much like Jack, in my travels, I've talked with so many people in our recovery centers. I've met the men and the women who struggle day in and day out to overcome their disease. I've met with their families. I've met with community leaders. And I've met with many substance abuse treatment professionals. Although they all come from different perspectives and backgrounds, they all agree on one thing, and that's early prevention. And by early prevention, it means adolescence. Intervention, the most important time to make a change in substance abuse is when it first begins. And statistics show that we have so many children in Kentucky that are already needing that intervention and treatment. If we're ever to curb the devastating effects that substance abuse has in the Commonwealth, the time is now. And this effort by the Attorney General's office and Jack Conway really does help us as we move forward. In the past, well, really up until today, Kentucky has not had the kind of resources to meet the needs of our children, of our juveniles. There aren't many options right now for children and their families who desperately need this help, particularly those that cannot afford it. As all of you know, I'm extremely concerned about our young people, about their education, about their health, and about their future, because it's also the future of the Commonwealth of Kentucky. In my work with Recovery Kentucky over these last 6 years, I became more and more convinced that the only way to curb substance abuse was to start finding a way to work with the children, to help these young men and women when this disease first begins. So in January of last year, actually it was even before that, talking with Jack, and then I camped on his doorstep for many days, talking about if we ever did have a settlement with any of the lawsuits with our drug companies, could we, any way, direct those funds to help our children and our people who are under the influence of substance abuse. We talked about ways that we could work together, and particularly about how we could fund any additional programs in this state. And today is a historic day, Jack. These settlements will this settlement of these funds will open up new beds. They'll expand inpatient and outpatient services for children. They'll help pregnant women with their substance abuse problems. They'll enhance Recovery Kentucky services, which has made such a difference in our state already. And it's going to open beds to those who desperately need it, but do not have the funding. We're not going to be able to solve all of our problems with this incredible amount of money, but we're on the right path. And we have the opportunity to truly impact the lives of so many people. And I know that with dedicated advocates like my husband, General Conway, Speaker Stumbo, and all of you that are here today, so many of you from the Recovery Kentucky Task Force, those of you in the cabinet who work with these children, those of you who have had family members that have been affected, this is an important day for recovery for the Commonwealth. We need to continue this fight. We've only just begun, but truly, we have made a major impact today. Thank you all.
And now I'd like to ask another partner of ours, a person who has joined with us from the very beginning of this battle to overcome the substance abuse issues that we face, the persistent issues that we face in this state. Speaker Stumbo has been there every step of the way, and I'd like to ask the Speaker to come up and say a few words.
Well, thank you, Governor, and congratulations, General Conway and Ms. Jane, for the fine work you've done. Actually, for those of you who have been around here a long time, you might remember that in 2003, I believe it was, 2004, I'm sorry, then Governor Fletcher put together a task force to deal with the drug problems in Kentucky, and that's actually, I believe, the first time I had a chance to work with Van Ingram. And as part of that report that the Attorney General's office prepared as its part of the report, we recommended funding for education and treatment because it became aware to us. And I was one of the first Attorney Generals, I think, in the nation maybe to say that we cannot incarcerate ourselves out of this problem, that we have to turn to education and treatment and a long-term sustainable type strategy if we're ever going to beat this problem that we have with drug addiction in Kentucky. Unfortunately, because of the economic realities of the times, we've not been able to fund that adequately, as First Lady Beshear indicated. But today is a very significant step. It's a well-deserved step forward. Thank you, General Conway, again for your efforts in this regard. A lot of people in Kentucky, I know, when they see that we're moving toward treating these people, educating these folks, and doing something proactively about the problem before it exists or before it persists to the point where it requires incarceration. That is truly a remarkable turn of public policy in our state, and I applaud it. I congratulate those involved, and I look forward to continuing supporting that as I can in my role in the state legislature.
Before we open it up for questions, I think Jack Conway deserves another round of applause. General, thank you. Anybody have any questions for the General?
Doesn't money from legal settlements usually go to the general fund, and how that's spent is determined by the legislature? And if that's the case, why is this being handled differently?
That would be the case if there weren't any required dispensations. If you recall, Jack, I guess it's been a year and a half or so ago, we had the national mortgage settlement, and monies came back. And that settlement was under a court order from a federal judge in D.C. that required the AGs to develop a spending plan and to report back to him. So if there's nothing like that, yes, we would have to turn it over under KRS Chapter 48. In this particular case, Jack, we have a court order that was entered into in Franklin Circuit Court. The court order is consistent with 48005. What the court order says is that the Attorney General, in his discretion, shall expend the funds for public health purposes, which shall include substance abuse treatment. If you look at the statute 48005, it says that the Attorney General turns over any excess money after required payments are made, and the court order requires payments in this state. So we're, in this instance rather, so we're well within our legal authority here.
Apparently that's okay with the Speaker. Is it okay with the Senate President?
Well, we've involved the Senate President in this process. We have briefed him. He was supportive of all the concepts as we went along. It's my understanding that recently he has expressed some concerns about legislative prerogatives, but we're comfortable that we're on very solid legal ground here. In fact, I'm acting pursuant to a court order. I'm the Attorney General of the Commonwealth of Kentucky, and I'm not going to go around ignoring court orders.
General, question for you and the Governor. Senator McDaniel has suggested requiring people that go into drug treatment programs pay something back to help fund it as well as expand treatment in the future. Would you support that concept, and how would you go about doing that, if you would?
Well, certainly the idea of having some skin in the game, as it were, is a good one in many circumstances. However, when you've got a broad situation like substance abuse that covers every economic strata of society, I think you've got to be very careful of putting any required co-pays, if you would, into getting treatment. This Commonwealth will get paid back 100-fold for every individual that we can get back on their feet and become a productive citizen of this society, because they'll contribute to our bottom line, they'll contribute to our economy.
To follow up on that, one of the things that I'm really pleased with in this program is more than $2.5 million going to these scholarships. We're talking about people who can't afford treatment in the first place. They're desperate. They have nowhere to go. Drugs have taken over their lives. So I think to say, when they get out, here's a bill that you have to pay, it's pretty tough. I think that this approach of trying to get them back on their feet is a good thing. And if someone gets back on their feet, chances are they'll repay it tenfold down the road. I can't tell you how heartened I've been to talk to. I've probably talked to 3 or 4 prominent business individuals in this state, very prominent business individuals, who have called me in the last couple of days that have heard what was going on. They've said, thank you, I'm 27 years in recovery, or I'm this, and what you're doing is the right thing. And oh, by the way, I participate in interventions, and I donate to this center, and I counsel people, and there are a lot of people that are involved in Recovery Kentucky that are involved in it because they had to intervene with their nephew or their own child or someone like that. So to say, here's a bill, I would suggest that if we're successful in treatment, the people that get out from underneath that terrible affliction will repay us in their own way.
Anybody else?
Governor,
Can I ask an unrelated question?
Well, let's see if there's.
was the Senate President invited to this news conference?
Yes, we were planning the news conference, and then after he expressed his concerns, we understood why he wouldn't be coming.
Along the same lines, there is going to be another push for medicinal marijuana, and some states even though have passed recreational marijuana laws. In light of this existing addiction problem, I'd like to get thoughts from General Conway and the Governor on this push for marijuana use in Kentucky.
Greg, have you filed your bill? First of all, I certainly do not support recreational use of legalization of marijuana. I readily acknowledge that marijuana is not as addictive as some of the substances such as these prescription painkillers or opiate painkillers or heroin that we've been talking about here today. But if you read studies, recreational marijuana use and frequent marijuana use, particularly amongst the adolescents and teens we've been talking about here today tends to lead to use of other drugs down the road and traps people in the cycle of addiction. So I would not be supportive of that. In general, I have not supported legalizing marijuana in any way in the past. If the medical community comes forward and wants to try to change my mind on that, then I'll be all ears. But at this point, my position remains consistent on that. Governor, do you want to address?
I agree with my Attorney General.
Governor, I just wanted to ask if you can give us, at least in general, an idea of the themes you intend to strike tomorrow evening in the state of the Commonwealth.
Well, tomorrow evening I'm going to report on the state of the Commonwealth and talk about a lot of progress that we have made, not just in the last year, but in the last 6 years. We have come a long way, even through the worst recession of our lifetimes. But we still have a ways to go, and we've got several core challenges that we need to continue to tackle and overcome if we are going to truly put Kentucky in the forefront of the states in this union when it comes to leadership in this country.
Will you be striking some of the themes you mentioned in the interviews you had with the media about a month ago, or wrap it up?
We'll be talking about education and health care, economic development, and public safety. Okay, thank you.